Um, our topic today is about assessment of the mechanical valves on CT. The focus is going to be around how to comment on the motion of the leaflets and how to comment on whether this valve is malfunctioning or normally functioning. On one of the videos on the channel, in a related video, that we discussed how to differentiate between Panna's clinical and subclinical valve thrombosis using CT. So today is going to be focusing on how to measure the angles and the focusing on the leaflet movement. And as you may know, of course, the number of patients receiving those mechanical valves is increasing. Kind of summary to the complications, but again, today's focus is going to be around or about the leaflet mobility and how to comment on the leaflet mobility. On the channel there is a video how to differentiate between a thrombus and a pannus, because those are very important complications. Maybe later in a separate video we'll comment or try to do a video about the paravalvular leak and how to see it on CT and MRI. As you may know, there are different types of prosthetic valves, one of which is the most popular or the commonest is the bi-leaflet valves. There are different manufacturers, so whenever you see a complication, it's important and paramount to check with the manufacturer specs of this bi-leaflet mechanical valve. This is how the valve would look like. So when it's open, as you may see, the leaflets are almost parallel to each other, and both of them are almost perpendicular to the skirt or to the ring of the frame of the valve. Many modalities are used. Every modality has its advantages and disadvantages, but we are going to focus on cardiac CT, where there are many benefits of assessment of mechanical valves using CT. So we could use it to see the malcoaption, if there is regurgitation, trans or paravalvular. We could comment on whether there is any migration or fractures, thrombus or pannus, and today we will see how to comment on the function. The protocol of acquisition is paramount because prospective padding and without the maximum radiation would lead to a repeat because of the metal artifacts. So either to do it retrospective, which is the spiral CT, that would include the entire cardiac cycle. So the CT would detect the QRS later, or retrospective after the acquisition, and then will divide will reconstruct the images according to your preference in cardiac phases, whether systole or diastole. So you could do a reconstruction every 5% or 2 or 10%, or maybe after according to milliseconds, every 50 milliseconds, for example. But retrospective entails the maximum radiation or the highest radiation doses in CT, while in a prospective, where the CT machine will detect every R wave and then will expose the patient to some radiation doses. It's less than the retrospective, but it's advised in the prospective to use a full RR interval, so from 0 to 100, or maybe from 10 to 90, but not less than that, in order to see the movement or the full opening and closing of the leaflets. Pulsing, but do not give the full doses. Do not use pulsing, because otherwise this will reduce the exposure, and this would lead to a very high metal artifacts and inconclusive CT scan. In order to overcome the radiation doses, you may reduce the field of view, so decrease the field of view around the aortic valve. So this might help to reduce the doses of the radiation. Example here where the valve is opening, this 20% and 30%, and then 40% is in kind that the valve or the leaflet started to be closed 50% and moving throughout the cardiac cycle. And here is a video how the the CT would look like, and we could easily comment on the function, whether there is a good or a malfunction of the leaflet. This is an example of a good functioning leaflet. How to measure the angles. So those are the bi leaflets that we saw in the images of the stents. And as you may see, this is the horizontal plane, and here are the axes which go through the leaflets themselves, and we're going to use this angle, and when it's closed we could use those two angles. So if they are parallel, this means that this angle should be less than 20. So this is the angle that should be less than 20, because more or less they are parallel leaflets. And when they are closed, it's never 180, but this angle should be 120 to 130 to consider a normal closed angle. For example, here is an example of a normal case and an abnormal case. So here the leaflets, the angle between the two leaflets is 11, and as you may remember, we said anything below 20 is okay. And here is 123 when it's closed. Axis it's not 180, but again 120 to 130 is acceptable. But for example here, so we could see the leaflets were not parallel to each other, so the angle between them was 70, which is considered to be a pathological, which means that there is a limited opening of one or two leaflets. And here the closing angle was 116, which is less than 120, which means even the closing angle was abnormal. So let's see how we could, most of the softwares would give you the facility to draw those lines through the longitudinal axis of the leaflets and through the horizontal plane. So you could measure this angle. If they are parallel, then this angle should be 90 and 90. Anything below 80 is considered to be suspicious, and you will need to go to the manufacturer to see the opening and closing angle. Again, if this angle is below 20, considered normal. If it's above 20, then go to the manufacturer and check whether this is a kind of malfunctioning or not. The same for the closing angle. So this is the line drawn through the long axis of the leaflet, and the same angle with the horizontal plane. And let's see, if this angle 30, then probably this angle is going to be 150, which is a normal closing angle. Again, here how we draw the lines. Most of the cardiovascular CT softwares, whether it's Singo and so CVIs, they would allow you to draw the angles, so you could measure easily. If this is 84 and the other side is 84, then probably the angle here between both of them would be less than 20, which means normal angles. Thank you.